Okay, let's get started. Hello and welcome everyone again. My name is Thalia from the Massachusetts Health Connector, and I'm joined today by my colleagues Nikki and Melissa, who will be presenting today's information. Together, we are here today to share information about the preliminary eligibility period and what you'll need to do to ensure you're covered for plan year 2025 and are enrolled in a plan that fits the needs of you and your family. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some more information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the question and answer button at the bottom of your screen. We will be monitoring your questions throughout. Please do not share any personal information or private health information when you ask your questions, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connectors Customer Service Center and instructions on how to find help from a local assister. We are recording today's webinar, and following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. Now we'll get started on our presentation.
Thanks so much, Thalia, and thank you everyone for joining us today. So as Thalia mentioned, we'll be talking about the Health Connectors preliminary eligibility and what it means for you as a Health Connector member. So during today's session, Melissa and I are going to share information about the Health Connectors annual renewal process. And this is something that each year the Health Connector has to do to make sure all the information we have about its members is correct before we renew coverage for plan year 2025. So if you are a Health Connector member and you want to understand your eligibility notice better, you want to learn how to update your online application, or find help with next steps to keep your coverage or change your coverage or even change some things in your application, you are in the right webinar. And actually, before I dive into today's topics, if you are a new member, let's say you've never applied for health insurance and you found yourself here, that is okay. Feel free to stay, listen to this webinar, or in the Q&A, you can actually just mention that you need some assistance, and my team members will work with you and share information with you. So that if you'd like to, just go straight to an enrollment assist or a customer service, you can do that as well. But for today's session, here's what we're going to be going over. We'll be talking about the Health Connectors open enrollment period, what all of that means, what you should know as a Health Connector member. Then we'll be talking about some of the notices that you receive as a Health Connector member, and specifically as it relates to preliminary eligibility. What are the deadlines? We will spend some time on accessing your online account and accessing your application, as well as talking about how to renew or change plans for next year, and then where can you get help. And my colleague Melissa is going to be available. I'm going to go through the slides. I'm going to try to go fairly quickly so that we can get to Melissa's portion where she is going to demo and show you exactly where to get into your online account, and then also show you how to find local help if you want some assistance. So just to level set, let's start with what the Health Connector is. For everyone's knowledge, we are the state's health insurance marketplace, and we're here to offer individuals, families, and small employers access to affordable health insurance coverage. So really, we're here as a place for people who don't have access to health insurance through their job, their partner, or another source. And a lot of people who apply for coverage through the Health Connector actually qualify for help paying. I will spend a lot of time talking about health insurance, but it's really important for me to also acknowledge that we do sell dental insurance through the Health Connector, and that is something you can purchase an add-on if you'd like. And then lastly, not for today's session, but just want to acknowledge that we do offer a program called Health Connector for Business, and that is for small employers in Massachusetts who have 50 or fewer full-time employees. So if you are a small business owner or you're interested in learning more about Health Connector for Business, you can go to Eventbrite and you can see that we do have an upcoming session on Health Connector for Business. So let's take a look at this timeline. This is about the Health Connector's annual renewals process for plan year 2025. So these are a set of activities that happen each year before and during the Health Connector's open enrollment period. So as a member, if you have health insurance through the Health Connector, you just need to know that you're going to have your eligibility checked or redetermined each year so that you can get renewed into coverage for the upcoming year. So I'm going to break these down into steps, but then also you'll see these steps repeated throughout in a number of communications. So we're in September at this point. Notices have been mailed to members. And then you as a member have a period of time in which you can respond to those notices, you can make updates. In the October timeframe, that's when the Health Connector sends a final eligibility and a renewal notice to all of its members. This is all in anticipation of open enrollment beginning on November 1st. And then there are payment and billing deadlines for coverage that starts on January 1. So as Leah had mentioned, no need to take detailed notes. You're going to get all of this information in an email following today's presentation. And we're going to dive into each of these sections a little bit further. So here, I just want to remind you about the types of payment help you can get through the Health Connector. So many members qualify for advanced premium tax credits, and these lower the premium amount someone pays each month. These are only available through the state's Health Connector because we are the state's health insurance marketplace. And because these are advanced premium tax credits, the way it works is the IRS sends your tax credit, whatever you're eligible for, directly to the insurance company that you're enrolled in. So you as a member just pay less each month. You also have some flexibility as a member. If you are eligible for a certain amount of tax credit, you can decide to apply all of that or dial that back a little bit. But we'll talk about advanced premium tax credits in a little bit further down, in a little bit more depth. Also important to remember is the Health Connector, the Massachusetts Marketplace, has a program that's unique to us. It's called the Connector Care Program. And this uses federal advanced premium tax credits plus state dollars. And together, that's how we're able to reduce the monthly premium amount somebody would pay. Connector Care has comprehensive coverage with low monthly premiums, low out-of-pocket costs, and no deductibles. So depending on the plan type that somebody qualifies for, their premium in 2025 could be as low as $0 a month or $264 a month. And I'll talk a little bit about premiums in a bit as well. So now let's dive into the eligibility notices and upcoming deadlines. So as we are going through the process, members are going to get notices, other messages, mailers. We just want you to be aware that it's time to get ready for open enrollment. Now, open enrollment begins on November 1st, as you can see in this flyer. And in this flyer, you're able to see that there is steps that we want you to take during this time frame. Also, you'll have an opportunity in October, early November to review your 2025 plan information. And then there's an opportunity to shop if you want to change plans. So if you've received this, certainly take a look, and you will be able to keep this page as a reference. Now let's move on to the preliminary eligibility notice. Now, on this notice, I just want to acknowledge that this is the formal letter. This is the letter, the detailed letter that you're going to get where you can review your information. We want you to check your details so that you know exactly what is on your application and you have an opportunity to make updates for the rest of 2024 or for your plan year 2025. So included in your preliminary eligibility notice is going to be a list of all the household members who are on your application. It also tells you about your current program eligibility plus your expected eligibility for plan year 2025. It will include your current FPL level and expected FPL level for 2025, and then instructions on next steps if changes need to be made for your application for 2025. So specifically, want to acknowledge that if nothing has changed for you or is going to change for this calendar year, your new eligibility enrollment will not start until January 1st. You'll stay in your current coverage through December 31st as long as you continue to pay your monthly premium. Now, there's other information about your account on your preliminary eligibility notice. It includes your member ID. It includes a username. And so we really just encourage you to please keep this notice. It's going to be useful if you need to contact customer service, or as we all know, we have so many usernames and passwords. It's good to have this so that when you go to the website, you're like, okay, that's right. That's the username I set up for this account. All right, now let's talk about accessing the application. So on this slide here, you're looking at the Commonwealth's application for coverage for individuals and families. So whether you are an existing member or you're newly applying for coverage, you be going to the same place, which is mahealthconnector.org. I want to acknowledge that the website is also, or the application, pardon me, is available in Spanish as well as Portuguese, and also that this is the one application for the Massachusetts Health Connector, help paying for coverage, as well as Mass Health coverage. Now, we'll be stressing not only keeping your application up to date, but really keeping your income up to date. And we want you to remember to update your income, if anything, if your employment situation changes, your household situation changes. And this is really important because keeping that information as current as possible helps to make sure that you get the right amount of help paying for health and dental insurance. It means you have a lower risk of owing the IRS money at the end of the year when you file your taxes. And also, I mentioned these advanced premium tax credits. We'll be talking about that in a bit, or we can certainly talk about that more in the Q&A. But there is a way, as an example, if you get, let's say, $500 a month in advanced premium tax credits, but you know that your situation, fluctuates throughout the year, you might decide to only use $400 of that tax credit. So keep in mind that you have flexibility. These are your advanced premium tax credits. So you get to adjust that amount from your application. Or if you need help doing that, you can, speak to someone in customer service or a local assister. Also related to income and keeping your application up to date, sometimes as people update their application, depending on what information they update, they're going to need to send in documents or proof. So if you owe the Commonwealth any proofs, please send them in within the required 90-day time frame. That's going to help you avoid any issues and keep you in coverage and keep you on track. Now on this screen, I want to talk about making changes to your application. And we've heard questions about this, and so I want to make sure that we spend a little bit of time. First of all, I want to acknowledge that the screen may look slightly different when you log into your application. However, just know that um, once you received your preliminary eligibility notice, if you logged in, you'll be seeing an application for plan year 2024. You also see an application for plan year 2025. So if you have changes to make to your 2024 application, meaning right now you can make those updates to your application that runs through calendar year 2024. If the information will remain the same for both years, you can update your 2024 application and apply the changes to your 2025 or next year's application before you submit. Now, you may be wondering, so how exactly do I do that? So you're going to log into your account, and Melissa will show you how to get there. And what you're going to do is you'll see a dashboard page, and you will click on report a change or report changes, pardon me. And then you are going to need to choose which year's application to change. So as an example, if the change has already happened or will happen by December 31st of this year, you'll choose to update the current year's application. So for example, if it is December and you're expecting the change to start in January of the following year, then update the next year's application. And once you choose the application year to update, click Edit Application, and that will take you to change your information page. There you're going to be able to choose the change or changes you need to report, and then click Report Changes. So what does your dashboard look like once you've logged into your account? This is what a sample member dashboard looks like. And then you are able to see, what it is you want, which section of your application you want to make. Again, as Thalia mentioned, as I mentioned, you will be receiving all of these materials. So all of these links are active. So when you get this presentation, you can click on the links. And this is going to take you directly to those instructions about how to update your income. Now, let's talk a bit about renewing or changing plans for next year. So we've been looking at the preliminary eligibility notice, but before we can decide or figure out what someone's final eligibility and the renewal looks like, in October, we'll mail a final eligibility and renewal packet to any person who is eligible and enrolled in a Health Connector plan. And it looks to be like it looks to be that they are still eligible for a Health Connector plan the following year. So when I say it looks to be, I'm going to try to say that in a simpler way. But essentially, sometimes people are eligible this year, but they are not eligible for the following year. An easy example is somebody could be no longer eligible because next year or excuse me, or at the beginning of the year, they're eligible for Medicare now. So if someone continues to be eligible for a Health Connector plan the following year, they'll get this notice, and it's going to include the health plan name that they're being enrolled into, the monthly cost for the upcoming year. If the person is eligible for advanced premium tax credits, that amount will be there. And really important to note that we follow guidelines to place members into their medical and dental plans each year. And if people were found to be eligible but did not enroll and they got a 2025 application, they'll also get a 2025 eligibility notice during this time frame. It won't have renewal information, but they will see a notice during this time. So really, really important. Open enrollment begins on November 1st. And all of these activities take place so that you can have your coverage be effective on January 1st of 2025. Now, if you are someone that needs to make a payment for your coverage, that payment is going to be due on December 23rd for coverage that is effective on January 1. So, when you're on the Health Connectors website, you're going to be directed to our renewal page. So, whether you're newly applying or you're someone who's shopping, you can go to mahealthconnector.org/renew, and you're going to, basically get prompted with these reminders of what you need to do, what time of the year it is, and how you can more easily access different tools. And these are the tools that we want to make sure you're able to get to. So the first is the Get an Estimate tool. So this is a great resource for everyone because a lot of times people think, oh, these savings don't apply to me. I'm not going to qualify for Connector Care Plan, etc. You can see if you can estimate what you are going to be eligible for, what plans are available in your area, and you can find this tool from the homepage of our website. We'll show you that. Now, we also have a plan comparison tool, and this lets you find out if the preferred providers and hospitals, health centers, facilities that you want to have be in your plan are covered through a specific plan. So you can use this tool as well, the plan comparison tool. The first two I've described, the Get an Estimate and the plan comparison tool, you as a regular person can go in and look at these tools. You don't have to be in your application. However, once you are in your online application, you can use these tools again through your online application, and all of the costs and all of the plans that you're seeing will be very specific to you. This is going to be available from within your application. So you've got to be logged in order to see the plans, the costs, and the details associated with you. Now, before we get to the end here, I just want to talk a little bit about the Connector Care program for plan year 2025. We recently voted on what this is going to look like for plan year 2025. So we have lots of options available with at least 4 and sometimes 8 available carriers in each region of Massachusetts. Fallon has expanded to several additional zip codes in different counties, Bristol, Hampden, and Plymouth counties. And then you can see some sample premium payments below, and this is broken down or displayed by plan type. So as an example, if you were in a Health Connector plan right now, and you were in a plan type 3A, and you were enrolled in the lowest cost plan, that plan would be $96. If you are looking at staying in the lowest cost plan and you're still a 3A in 2000 at the beginning of the next year, that is going to cost you $99. Now, if I'm a plan type 3A member and I'd like to enroll in a different plan that isn't the lowest cost plan, I am able to do that. You do not have to stay with that carrier that you've been with this year. However, just note that there are going to be a range of premiums, and it's going to be dependent on which plan you choose to enroll into based on the plan type that you qualify for. So I know I've shared a ton of information, and you might be wondering, okay, this is a lot. Where can I get help making my decisions and making sure that everything is okay? So there is free enrollment assistance available throughout Massachusetts. You can work with our customer service center, and you can work with different community partner organizations to get the support you need. So for customer service, we are at 877-623-6765. For for people who are deaf, hard of hearing, or speech disabled, we have a TTY number, which is 711. If you go to our website, you'll see information about our hours, days of operation, particularly during open enrollment, beginning on, I believe actually just before open enrollment and then throughout open enrollment, we'll have extended hours. So you want to check that out on our website. And then we also have local events where you can go to and you can get support. So our website will be updated as we go and get closer to open enrollment. Now, I mentioned these community partners. I want to tell you who they are. These are folks who were trained and certified as navigators or certified application counselors, and they work at different facilities across Massachusetts and speak many languages and can help people from their application all the way through enrolling in health plans. So if you have questions about notices, you have questions about the application, plan details, etc., they are there to help you. Certainly, as we're getting closer to open enrollment, it's a good idea to make an appointment so you can get in for help when you need it. So my colleague Melissa is going to show you how to use this tool so you can find free help near you. So before we move on to questions, I just want to ask my colleague Melissa if she's ready, and I will hand this over to you. I will stop sharing and hand this over to you.
Thank you so much, Nikki. And I'm just going to go ahead and share my screen. If you can just bear with me for 1 second. And hopefully you can see that now.
Yes, I can. Thank you.
Perfect. Okay, perfect. So to get to our website, you would have to type into your browser www.mahealthconnector.org. And on this page here, you're going to get the message, do you need health coverage? So I just want to show real quick. So you'll have two options, whether you need to apply now or learn more. So if you just click on apply now, it will bring you to to this other page here. Welcome to the Massachusetts Health Connector. So it will say whether you want to start your application for health coverage. You can simply click on apply now. But if you do not have an account with us, you would want to sign in to create an account if you're not an existing member. So again, if you're going to apply now or make any changes to your account, you would need to sign in. You would have a special account. You would have an email and your password in order to sign into your account. And then if you scroll to the bottom of this page, you have other options here. If you did not want to start the application, you were hesitating for whatever reason, you weren't sure, we have other features here. This one here, see what you may qualify for. You would simply enter your zip code, the date that you wanted your coverage to start, and to see if you can get any help for paying for health coverage. And then from there, you can start, and then it would basically guide you through the entire process and show you what you may qualify for. We also have a feature here where you can preview health and dental plan and prices. And we also have reminders here, important date reminders, and quick links. So from here, if you were confused or you needed more resources, you can click on Learn More, or you can also click on Get Assistance. I'm going to click on it real quick. And here is our help center, and it's great tool for you if you were new to our website, new to the application process, and you were uncertain on, how to do the application, or, navigating through plans, or you needed help shopping. We have some assistance here. You can find an enrollment assister here, somebody who can help you, who is trained and certified to help you with the application, through the enrollment, and basically answering questions that you may have. And then if you continue to scroll down, there's more resources here and frequently asked questions. So basically, just detailing how you can get help, ways in which you can get help, how the application process works, how eligibility works, more information about the advanced premium tax credit, and so on. So these are just great pages just to save and to go back to if you were starting or if you were coming back to our website. So I'm going to end here so we can start questions.
And Melissa, maybe we can just keep the screen up just in case we need to show anyone
Oh, sure, of
if somebody
course.
wants to. Thank you so much.
Sure. Let me just put it back up here. All right. Great.
So first few questions are about notifications and notices. If someone did not receive a notice but would like one, can they request anywhere to receive it?
Yeah, this is a great question. So any Health Connector member can access any notices that they want to get a copy of from their member portal. So you would just need to log in to your account, and then you'd be able to go in and you could download and print a copy of a notice. So if you are looking for something and you don't believe that you've received it, you can do that. Melissa, they can also call customer service, right, and request another copy mailed to them if they're not able to go into the account.
Definitely, yes. We can also be able to resend a notice to our members.
And for some reason, if they no longer qualify for a plan with the Health Connector, will they receive a letter stating that as well?
So when someone applies for coverage, and Melissa definitely will use your help here to explain from another angle, but when someone applies for Health Connector coverage, if they are approved for Health Connector coverage, they will get an approval letter talking about their eligibility and kind of telling them next steps. They'll also get a letter from Mass Health. We know this part's a little confusing, but we want to make sure you understand why this happens. Because we share an application with Mass Health, we're required to send you a letter that says you qualify for the Health Connector, and then another letter that says, but you do not qualify for Mass Health. Now, if someone has lost their eligibility for Health Connector coverage, you'll get noticing, but it's going to be dependent on the type of noticing you get is going to be dependent on the reason why. So, Melissa, the one thing that comes to my mind, let's say if somebody's been required to make a premium payment and they go through a process, they, don't pay their bill, etc. I'm kind of, I'm trying to keep this not complicated, but that's the first thing that came to mind is why somebody might no longer be eligible. They would receive a number of notices before that happened, but ultimately, yes, they would get a notice that says they're no longer eligible. Is there another simpler situation? I didn't mean to complicate that one.
Oh, yes. So another example would be if we needed a job update and we didn't get it in the time frame that we were supposed to get it. So when you go back to apply, you would be denied and you would get a letter indicating that we just need an update from you. And it would, go into detail exactly what is required. And once you are able to fax that over to us or mail it to us, we would be able to reopen the application and go through the entire process. So you definitely know every time exactly what is required in order to be eligible.
Great, thank you. I like your scenario better.
Thank you.
I think that makes a lot of sense. And also, Melissa, can they upload, let's say somebody owes us a document, can they go into the account and just upload that document if something is owed? Is that the fastest way for them to get a document over to us or Mass Health?
Yes, that's actually a quicker way. It's much faster to upload it. They still need to process that document, and usually the processing time would be 3 to 5 business days. And then you would get information in the mail of whether or not more information is required or if you're upset all set with the whole process.
Okay, great. Thank you.
Sure.
Okay. Just a couple questions on reporting income. So to provide the most accurate information to determine eligibility, what income figure do I need to provide for my tax return?
So I'm not going to be able to quote exactly what lines in somebody's tax return. So maybe if I can talk about it more generally, and then when we send out the follow-up email, we'll send you the direct link so you can see all the different types of income. But essentially, the kinds of income you want to include are things like incomes from job income, like rental income, um, if there are, I'm just trying to think, if there's like a substantial gift that you've received, that is something you'd want to report. But Melissa, I feel like you're much more equipped to answer. I'm going to hand this over to you to make this more practical.
Sure. I like to tell people any taxable income you want to definitely include in the application. And I think you've said most of them. I think dividends is included, any investments, rental. Um, I can't think of anything else, but when you go into the application, you actually have a list to choose from, and you can check off whichever applies to you, so that there's no confusion whether or not you're missing anything. The application will guide you through that process.
Great, thank you.
And more questions on income, a few about those who might be receiving unemployment benefits, but that might be coming to an end. How do they go and update their application if they are no longer going to be receiving those benefits?
So with unemployment, okay, so I want to talk a little bit about current income and then projected income here. So when you're in the application, the application is going to ask you questions about your current income. And then it also asks you questions about what you think your income is going to look like over the course of the year. So if your unemployment income is going to be coming to an end, um, what can do essentially is update what you think your projected income is going to be for the year. So you'll do some math essentially to figure out like, okay, I'm not making X number of dollars each week now because that unemployment income has ended. But Melissa, from a practical perspective, is there an end date where you can say unemployment's ending, or how does someone um, indicate that like it's no longer available to them?
So I like to tell members just to do the present day. So if they don't really have like, if they haven't approached their end date, once they do approach the end date, I would just have them update the application. But also, usually, like you mentioned, it is included in the projected yearly income so that we can get the best estimated amount there. And then if there's any issues, the system at the end would let you know whether or not we needed verification. So you would get an income verification notice if we needed more information from you. So at that point, we would be able to identify exactly how much your projected yearly income would be, hopefully.
So Melissa, is it basically better for someone then if they know their unemployment's coming to an end, would you say let it come to like run through that cycle and then go back in and update your income at that point, like once the unemployment has ended?
Definitely. I think that's the easiest way just to not make it confusing. So once your unemployment ends, you update us, and then you should be fine with the system basically telling you your eligibility at that point.
We also have a couple questions on what is included in Health Connector plans. So just clarifying if they have if vision is included in our healthcare plans, and if dental is included in our healthcare plans. So just wanted clarification on that.
Sure. So our Health Connector plans, there will be some limited vision benefits, or some plans may have limited vision benefits. If someone is interested in a dental plan, we have separate dental plans. So you would have to enroll in a dental plan. But that's how our plans are structured.
Okay. Sorry, might go a little bit out of order here. I'm trying to cluster them together. So, I was paying for COVID previously. My coverage, my coverage just signed up under Mass Health starts on October 1st. Can I cancel Cobra starting on that same date?
Okay, so let's talk about Cobra a little bit. As we know, Cobra can be an expensive endeavor. Um, and basically, the rules are once somebody has signed up for Cobra, and they commit to Cobra, they need to stay in it until it ends. Unless they signed up for Cobra and they were in a situation where their employer was paying part of it, and then that subsidy ended. So with Cobra, that like you can either, pay and stay in it the whole time until your eligibility, or you can, if you were getting some help paying for it, you can, and that help stops, you're able to disenroll from it. Or if you're coming up to the Health Connectors open enrollment, so let's say um, you're in Cobra now and you don't want to be beginning on January 1st, you can drop your coverage and enroll for January 1. Melissa, I really can't speak to Mass Health eligibility with Cobra. If someone is Mass Health eligible, I mean, we can take that offline perhaps, because I don't think we want to speak for on Mass Health's behalf. I comfortably speak to like the broad Cobra questions. But I may recommend that if the person is Mass Health eligible, that they call Mass Health customer service and just confirm, the right way to end their Cobra because they are Mass Health eligible, or it appears that they are Mass Health eligible. Does that feel like a good direction for them?
Yes, that definitely sounds perfect. And if I just can add one more thing,
Yes.
if you knew your Cobra was ending, let's just say for an example, October 1st, for whatever reason, and you wanted to make sure that you have active health care coverage, if you can apply before the previous month by the 23rd, just to ensure that you're active. So for example, you wanted insurance for October 1st, just apply by September 23rd. That way you know you're all set for the upcoming month.
Great. Thank you so much.
Sure.
And I have seen a couple questions asking for some clarification between Mass Health and the Health Connector. People are a little bit confused because we're saying you might be eligible for Mass Health, but then if you're not, you could come to the Health Connector. Can we just get some clarification on that, please?
Sure, no worries. That's okay. So the difference between Mass Health and the Health Connector. So Mass Health is a insurance plan where you don't have to pay a monthly premium. And they usually follow very strict income guidelines. Whereas the Health Connector is different, where you would have to pay a monthly premium cost based on your income. And they both have different eligibility requirements. So when you are applying, the system is able to determine which one you fall in. And then you would get more information on if you sometimes people qualify for both. Sometimes you can qualify for just one of them. And then you'll get information as to what steps you would need to take in order to be eligible. With Mass Health, sometimes if you are eligible, you just would have to submit income verification, usually, but everybody's different.
And Melissa, I think let me know if how the internet is. I think it's better. It's back to normal, I think. The only other thing I would add is Mass Health is our state's Medicaid program, and Health Connector plans are our state's marketplace plans. So where the Health Connector is the state's marketplace, Mass Health is the Medicaid program.
And for the plans that are available through the Health Connector, do any of those plans cover areas outside of Massachusetts?
I'd want to get back to folks on that. The plan networks may go a little over into surrounding other surrounding states with us. I'm just thinking of people particularly who are like on the border close to New Hampshire or Rhode Island, etc. But let's confirm that. Generally speaking, Health Connector plans for individuals and families, they're going to cover your benefits and services in Massachusetts. If a person is, let's say, out of state and they have an emergency, that emergencies are in fact covered. But if somebody is getting routine care, I know they're expected to get their care within their carrier, their plans network. So if you are, I guess I'm looking at it from a couple of different angles and can comfortably say, like, if you want to find out, let's say you live in an area of the state that borders an area of Massachusetts that borders another state, and maybe you have a provider who's out of state, just double check and see if that provider is included in your plans network. But if you're traveling outside of Massachusetts, these plans are not PPO plans. These are HMO plans. Did I confuse? Does that make sense? Maybe I shouldn't use those terms. I won't use HMO and PPO. I guess what I'm trying to get at is the out-of-state services. I would check with the individual carrier for out-of-state services, but know that all of these plans will cover you if you have an emergency. I think that's probably a clearer way of saying it.
I think this might have been the same person who asked this question. I think they're asking about maybe a child who's attending college outside of the state and if they would still be covered. I think they might be asking for that reason.
Okay, I think what I would do is check with the carrier. Fairly certain that it is what I stated, like routine care is expected to happen in Massachusetts within the provider's network. And if there is, an emergency, just check to see what the requirements or what the plan restrictions are directly with that carrier.
Okay. So more questions about income. Sorry, guys. Trying to look through all these questions. Is there a penalty if I underestimate my income at the time I qualify for subsidized plans?
Melissa, can you take this one?
Sure, of course. So you want to put the best guess possible in the application. And I know that sometimes that can be really hard to do. So again, that's why we sometimes ask for income verification because we want to make sure you're in the best eligibility. So also another reason why we want to make sure that we put in the best, the amount is because at tax time, when it's time to pay back your advanced premium tax credit, we want to make sure that we're not going over that amount. So just trying to put in the best amount that we know, the best guess, would be the best thing to do. And if there's any questions, you can always reach out and we can help you.
Yeah, and I guess what I would add to that, Melissa, is um, and I know people think of penalties in different ways, but when we talk about advanced premium tax credits, if someone over, I'm sorry, if someone underestimates their income and then gets more APTCs, they could be in a position where they owe APTC or federal tax dollars back. Is that right?
Yes, that's correct. And we want to try to avoid
Avoid
that. Yeah.
that. Yeah. So do reach out. As Melissa said, do reach out to customer service or a local assister so that you're not overpaying.
Okay. Can my husband, who is Medicare eligible, have a dental plan through the Mass Health Connector?
Easy, yes. So people on Medicare, yes, if they want a dental plan through the Health Connector, absolutely, they can buy a standalone dental coverage.
Okay. So I am turning 65 in April 2025. Will I still be eligible for coverage on January 1st, 2025 until April 27th of 2025?
So if an individual is up until a point where someone is eligible and enrolled into Medicare, they can stay in a marketplace plan. Once somebody is enrolled in Medicare, they can no longer be in a marketplace plan. So the short answer is yes. Until you get there, you can stay enrolled in a Health Connector plan. So that should not be an issue.
Can an employer contribute to payment of the premiums?
Not, I'm trying to think of the best way to respond to this. The Health Connector, the plans available on mahealthconnector.org for individuals and families, these are set up for individuals or families to enroll. These plans are not set up so that an employer can come in and pay for a part or what have you. The coverage here truly is for individuals who do not have access to coverage through an employer, through a spouse or partner's employer-sponsored plan. So there isn't a mechanism that would allow an employer to contribute towards the premium here. I don't know, Melissa, if you'd want to add anything here.
No, that's perfect.
Could you please tell us a little bit more about the advanced premium tax credits plus Massachusetts state subsidies and how to use it right away to lower my monthly premium?
Sure. So when somebody applies for health insurance coverage, based on all of the information they include in their application, they're going to be found, you'll get an eligibility result. And if you appears that you qualify for advanced premium tax credits, it will tell you what that amount is. And you will see based on, again, your eligibility, if you're in a place where you qualify for connector care plans, you automatically will get state dollars contributed towards your monthly premium. And then you will see the advanced premium tax credits. Those two things together will reduce the monthly premium so that you as a person, as the member, just pay the lower premium amount. Melissa, would you describe it differently? I just want to make sure I'm getting.
That's perfect. Yeah. So, right, when you finish the application, you get your eligibility, it will show you what you get, and then you can kind of like hover over it because you have the option of whether or not you want to use that amount. And you can use partial, it's up to you how much you want to use towards your monthly premium cost. But it would tell you right away how much you get.
Just for clarification, people we use the phrase check with carrier. People want to know what carrier means. And that just means your health insurance company. So, for example, Blue Cross Blue Shield, Harvard Pilgrim, that's what we mean when we say carrier. What else? Sorry, there's so many questions. Um, how does it work if a dependent is going to be under his own insurance through the application and the timing of approval?
So I'll answer from one angle. If someone is in your tax filing household, then you should include them on your application. If someone isn't in your tax filing household, then they can file their own application and be determined eligible separately from you. That is really a decision. Like, you know what I mean? That's like your household, your family's decision. So, Melissa, back to you for your input here.
That's perfect. Yes. It goes by your tax filing household. So the application will guide you through the process. So it will ask you if you are claiming a dependent. And if you are, it will ask who the dependent is. So you would have to include them. But once you stop, having that person on your tax filing, you no longer claim that dependent person. They can go on their own application.
And I think we have time for one more question. So if my income increases and now my premiums are more than I would get from my new job, how can I get a letter discontinuing health connector coverage, so I can get coverage at work since work enrollment has ended?
I'm trying to, Melissa, I'm sorry. Could you take that one? I'm trying to like process the.
Sure. So I just want to make sure I understand. So this person no longer has health insurance through their employer, and then now they want to see if they can have coverage through the health connector.
I think they're asking if their premium is now higher. Honestly, wait 1 second. If the person who asked that question can just clarify that for us.
Yep.
Yeah.
And then I also just wanted to clarify something. I think when we were responding to the question about employers paying for plans, it can get a little tricky when you're in the online application. If the employer offers what's known as a QSERA plan, and we will send this information because apologies, this is a little atypical. But if they offer what's called a qualified small employer health reimbursement arrangement, that helps pay the monthly premium. There's a section in our on that online application that the person would need to fill out. So when we send the follow-up email, we'll send information about QSERA as well. And apologies, it's not something that's typically it's not something very typically that employers do, but just in case the person who had that question was thinking about a QSERA plan.
And I think we are all out of time for questions. We definitely encourage those who had more specific questions to reach out to navigators or CACs and use our tool online, like Melissa showed you, to find a navigator or CAC near you who can help you in person or over the phone, however you're comfortable. Thank you all for joining us on today's webinar. From everyone at the Health Connector and all of our assisters across Massachusetts, be safe and well, and have a nice day.